we will talk about HIV and AIDS, focusing on the early signs and symptoms of HIV, the primary risk factors, what happens if left untreated, and treatment options, as well as whether it is curable. HIV stands for Human Immunodeficiency Virus. This virus attacks immune system cells and causes immune deficiency over time. If left untreated, the infection progresses into acquired immunodeficiency syndrome, known as AIDS. At this stage, the body loses its ability to fight off infections and certain cancers, leading to a fatal outcome, typically within 2 years if untreated. HIV was first discovered in the late 20th century, and it is believed to have been transmitted from infected primates to humans, particularly hunters. The disease spread rapidly in the following decades. A famous figure who died from AIDS was Freddie Mercury, the lead singer of Queen, in 1991. HIV is primarily transmitted through sexual contact and disproportionately affects homosexual men, intravenous drug users, and sex workers. In the early years, there was a false belief that the disease was caused by immoral behavior. Today, 70% of new cases occur in Africa, although HIV is present worldwide. HIV is transmitted through almost any type of sexual contact, as well as through body fluids and breast milk. This means transmission from mother to child can occur during pregnancy, childbirth, or breastfeeding. Fortunately, HIV does not spread very aggressively. For example, during heterosexual vaginal intercourse, the average risk of transmission is less than 1%. However, the risk increases significantly when other infections are present. Once the virus enters the body, it attacks immune cells known as CD4 T lymphocyte. It enters these cells, replicates inside them, and eventually kills them. The first symptoms of HIV typically appear 2 to 4 weeks after infection, but they are often so general that it is difficult to differentiate between HIV and other common illnesses like the flu. Early symptoms include fever, sore throat, and fatigue, but a distinguishing feature is a maculopapular rash, along with more prominent lymph node enlargement. These symptoms last for about 2 weeks, after which the chronic phase or clinical latency phase begins. During this latent phase, the virus continues to replicate, but less actively. There may be no symptoms, or the symptoms may be so mild that the person is unaware they are infected. This phase can last for several years, typically around 10 years without treatment, but sometimes much longer or shorter depending on individual cases. Eventually, the immune system becomes severely weakened as the CD4 T lymphocyte count drops below 200 cells per deciliter, marking the progression to AIDS. At this stage, symptoms such as persistent fever, weight loss, night sweats, chronic diarrhea, fatigue, and weakness appear. The person also becomes vulnerable to opportunistic infections. In individuals with a normal immune system, certain infections, such as pneumocystis pneumonia, are usually not dangerous. However, in people with AIDS, pneumocystis pneumonia is often the first and most significant fungal pneumonia. Other infections include toxoplasmosis, a brain infection, and cytomegalovirus, which can affect the eyes, lungs, and gastrointestinal tract. Tuberculosis is also a significant concern, especially in regions where TB is prevalent. Additionally, cancers can develop, such as Kaposi sarcoma, a skin cancer, non-Hodgkin lymphoma, a blood cancer, and invasive cervical cancer in women. People with AIDS often die from these opportunistic infections, particularly pneumocystis, pneumonia, or tuberculosis. Sometimes cancers like Kaposi sarcoma and lymphomas are the cause of death. HIV is one of the most insidious infections because it attacks immune system cells, specifically CD4 lymphocytes, which play a crucial role in coordinating the immune system's defense against infections. The virus integrates itself into human DNA and remains latent. Even after treatment, it can reactivate. Additionally, HIV mutates at a high rate, helping it evade the immune system, and over time, the immune system becomes exhausted in the fight against the virus. To diagnose HIV, you should look for early symptoms 2 to 4 weeks after engaging in risk-related behaviors, such as unprotected sex or intravenous drug use. During this period, and HIV antibody screening, tests can detect antibodies against the virus in the blood. An antigen test is also available which detects a viral protein P24 and can identify the virus earlier. For confirmation of diagnosis, the HIV RNA PCR test is used, which is the most sensitive and can detect the virus within 10 to 14 days of infection. If a person is infected, antiretroviral therapy (ART) is initiated. Treatment is essential to control the virus, maintain immune function, and prevent progression to AIDS. CD4 T cell counts and the amount of HIV in the blood should be regularly monitored to assess the effectiveness of the treatment and the patient's immune health. Modern antiretroviral treatment involves combination therapy, which uses at least 3 antiretroviral drugs from different classes to suppress the virus effectively. These classes include reverse transcriptase inhibitors, integrase inhibitors, and protease inhibitors. Many of these drug combinations are available in a single pill taken once daily. While treatment is lifelong and not a cure, it allows people with HIV to live almost normal lifespans. Modern medications are usually safe with only mild side effects. However, liver and kidney problems can occur, and although serious, they are rare. With effective treatment, most people live a normal and fulfilling life. Early treatment leads to better outcomes as it preserves the immune system and avoids complications. The effectiveness of treatment in cases of early intervention is higher than 95%. Late treatment is still effective, but some damage may be irreversible depending on the patient's current condition. Currently, there is no cure available for HIV. Antiretroviral therapy (ART) can control the virus but does not eradicate. The virus can hide in latent reservoirs within the body, making it difficult to eliminate completely. There have been several reports about a complete cure for HIV, most notably the Berlin patient case. The idea is that if you transplant bone marrow from a donor who is resistant to HIV, the patient may be cured because the donor has the CCOL5 mutation, which makes a person naturally resistant to HIV. This is referred to as a functional cure. However, this treatment is not widely used or approved due to many limitations. Bone marrow transplants are highly invasive, especially for people with HIV. Additionally, donors with such mutations are rare, and long-term effectiveness data is still not widely available. Gene editing may be a safer alternative with similar results, but it is also not approved or clinically used due to risks and ethical considerations, although it has already been done successfully in animal studies. Early detection of HIV through testing is crucial because it allows individuals to start antiretroviral therapy sooner, improving health outcomes and reducing the risk of transmission. When treatment reduces the viral load in the blood to undetectable levels, the risk of transmitting HIV to sexual partners is effectively zero. There's also pre-exposure prophylaxis treatment, where a person at high risk of infection starts treatment to reduce the risk of acquiring the virus. It reduces the risk by almost 99%. Additionally, with treatment of an infected mother and child, the risk of transmission can be reduced to less than 1%.